everyone. I'm Magali. I'm one of the POCUS fellow, and today we're going to discuss some images that could be either a cyst or not a cyst. I have nothing to disclose. We now are part of evaluations accredited, so you can sign into that link that you see on the screen and just provide us some feedback during evaluations. So the learning objectives for today are recognizing, assessing, and diagnosing cystic masses. Oh, challenging. So we're going to start with a little case, and that is just for the beginning of the presentation. You'll see that very quickly we're not going to have those case slides anymore. So you have a 2-week-old female that comes into the emergency. She has a right-sided neck mass that was noted actually on antenatal ultrasound already. So the mother knew about that mass, but it's increasing in size over the past 48 hours. There is no pain, no drainage. The skin has no color changes, and then the baby has no difficulties breathing, neither to feed.
She needs to leave the ED and go to a family doctor.
Agreed. She's perfectly well on exam.
Yeah.
She's at Sick Kids. She's at Sick Kids, yeah, you know, for second opinion as usual. So you definitely see that mass. It's fluctuant, fluid-filled, and it's over the medial aspect of the right clavicle. What is
medial
it?
Aspect of the
So
right
here it
clavicle.
is.
Oh, right. Yeah. That's cystic,
what is it?
Cystic hygroma.
But you've seen both, or like both of you have seen that case already.
No, I just...
It's exactly
that's like cystic hygroma looks like.
Yeah, agreed. Unless we shouldn't call it cystic hygroma, because it's actually, cystic hygroma comes from old nomenclature, and it's related to like bad syndromic illnesses. And so you don't want to call that the cystic hygroma, because it's actually just a lymphatic malformation without any syndrome. Okay, but you're right.
So what do you want to call it then? What's the
Lymphatic malformation. Okay. Yeah. So on ultrasound, that's how it looks like. So you can see all those hypoechoic structures with septations in it. If you apply pressure on it, it squeezes. And it's challenging because, of course, the baby is moving a lot, right? So like, even if you try not to apply any pressure, you're still applying some pressure on it. Here's a second clip where you see a little bit better. It's really like, it's kind of big, like what, 2 centimeters? Fluid-filled structure. Very, very soft. And because you love color, you apply some color on it, and that's what you see. So there is no flow in the structure. There is flow around it, but nothing inside the structure. So that's how you can define lymphatic malformation compared to a venous malformation or an arterial malformation where you're going to get some flow. It can be challenging with a patient that moves a lot, for sure.
Yeah. You're going to show us probably maybe that, but if you remember, like when we see like, don't speak? No, I mean, when we see like images of, sometimes you see images of bronchial sepsis, so like,
yeah, there is a, yeah,
the content inside like is, right? A lot of times,
yeah, so we're going to have, exactly.
So that's interesting. Why is that looks like that?
Yeah, exactly. No, we're definitely going to discuss that as well. But just to describe that structure, it's round, oval shape, it's fluid-filled, it's multilocular, there is no flow, and it's partly mildly hypogenic because the lymphatic fluid is actually a little bit kind of milky. So that's why, because of the like lipid content of it, you have that kind of partly mildly echogenic. And it is a lymphatic malformation, absolutely. Then you have a second case that comes. She's 12-year-old female, and she has a right-sided neck mass that appeared 10 days ago. The size of that mass has been stable over the past 10 days. It's mildly painful, and she was actually first seen by her family doctor, who started her on amoxicillin for 7 days. But there is no changes at all. She doesn't have any fever. She has no difficulties breathing or swallowing. She has a normal voice. There is no upper respiratory tract infection symptoms, and she has no past medical history of neck mass. She is on exam perfectly well. And you definitely see and can appreciate that huge mass, 4 centimeters. It's mobile. It's the upper right neck. There is no redness of the skin. It's mildly tender on palpation. It's very firm. So compared to the previous, like it would be the same type of localization as the previous picture that I show you. I show you. I don't have any picture for that case. But what do you think it could be?
Or differential diagnosis.
Don't really know. So you
can
take your
range
ultrasound.
from- Yeah.
What is it near? What is it?
So we see a fluid-filled cyst, which is the content is not hypoechoic this time. It's more.
It's not hypo.
It's not hypo, yeah.
Yeah.
It's more hyperechoic.
Exactly.
And I would say probably it's a bronchial cleft cyst or something like that.
Yeah.
That's,
Exactly.
but as Mark taught us to say, we need to say collection, origin, unclear.
Yeah,
So
origin
it's going to be
unclear.
under this
That's right.
kind of definition.
But origin unclear.
Origin unclear.
Yeah. Like we decided we're going to divide our neck masses according to the way we're going to manage them. So like say if we think it's a lymph node, we would say lymph node no collection, lymph node with collection, or let's say lymph node suspected malignancy. Something that Mark made up for research issue, but it makes sense I think to me.
Yeah.
Because like for us it doesn't really. Right now we speak about let's say lymphatic malformation, but all of this group like belong to some kind of collection origin clear, and most of the time like our management is going to be something similar, right? Like yeah. So.
But why not a lymph node though?
Why not a lymph node? So first of all, because you're not lecturing today about lymph nodes, so that's just,
Who knows?
just kidding. No,
Cysts are not a cyst.
yeah,
That is the
no.
question.
We don't see central hilum. We don't see the normal architecture of the lymph node, like the building or like the follicular centers inside. So it looks something different.
Yeah.
It looks very homogeneous inside, which again doesn't look really much like a lymph node.
Yeah.
So this is why.
It looks like a lymph node.
Sorry?
It doesn't look like a lymph node.
Mm-hmm.
And it would be like coalesced lymph nodes if it was all in that area. It would
Yeah.
be one structure.
Here it's just the long axis of this, longitudinal axis of the mass. But exactly, like you do not really see any, there is no hilum. What can you do to make sure that there is no hilum?
We can try to put flow.
Yeah, here it is. So you definitely have flow around the structure, but not in the structure. You cannot find any hilum. And right, like it's very homogeneous in the kind of low hyperechogenicity, but it's very homogeneous, round shape. So yeah, more like, and there is also a capsule around, like you can appreciate some kind of structure around it that you wouldn't see if it was a lymph node. It looks like a testicle, but without flow in the testicle, pretty worrisome.
And it's the neck, so that's more worrisome.
Yeah, I mean, it's really, really unusual. And she's a girl, but I mean, who knows?
Another thing that I think we need to keep in mind, but it doesn't look like that. It's like to say that why it's not, let's say, a malignant lymph node. So
Yeah, that was going to be my question.
yeah, because like it's not hypoechoic, but again, we don't see any septation, we don't see flow inside, we don't see calcification inside. It looks very like homogeneous, like
Yeah, malignant lymph nodes are
Structure?
usually not homogeneous.
exactly. And also you have the clinical story to
Yeah.
Another point that you can make for why this is not a malignant lymph node is that it's too oval shaped. When you have malignant lymph nodes, they tend to be more round and don't have that nice oval shape. So that also doesn't fit a malignant lymph node. Although I agree, it should come up, to mind at least when you're looking at it.
Yeah, just to make sure we are not missing that.
Thanks. Yes, absolutely. So now if you want to describe it, so it's round to oval shape. It's not really fluid filled because it's more, there is nothing moving in it really, and it's firm. It's unilocular. There is no flow inside, and it's encapsulated. And so it's probably a bronchial cyst. Here you can appreciate all the other structures that you could see in the neck. We're going to have a couple of examples of the other structures as well. And so based on where you
that's
have the
nice.
mass,
Where did you find this nice picture?
Google.
Yeah,
Great picture.
Yeah, Google is amazing.
That's a very nice picture.
Yeah. I mean, if you do remember Jason's lecture on neck masses,
Yeah.
he actually used that picture as well.
Jason?
Yeah. So we actually
Jason
look for
found
pictures.
something in Google.
Yeah, exactly.
Let's maybe search for it. Wow.
Yeah.
That's impressive.